you have a lower denture and you're having trouble eating and finding that it's moving around and not allowing you to chew properly, here's what you can do today to try and improve that situation. Let me start by saying that bottom dentures are less stable than upper dentures for a variety of reasons. To begin with, the lower jaw actually resorbs much faster than the upper jaw, so over time there's less and less bone to grab onto. As that lower jaw shrinks away and gets smaller and smaller, there's less bone and less area to really grab onto and make a stable lower denture. In addition to that, you have to worry about the tongue attachments, the cheek muscle attachments, and also, even if you make the perfect lower denture, if you actually open your jaw wide enough, the jawbone can flex and break that seal. So we're up against a lot of obstacles in making a lower denture that fits and stays in place. It is normal for lower dentures to have less stability and a little bit more movement than upper dentures. Before we get into any tips or tricks, you have to make sure that you have a well-fitting denture. So if you have a denture that's old, and you've had a lot of bone and tissue remodeling, that may be the primary reason why your lower denture is moving around. But if you have a new denture and is made well and constructed well and you're still having some issues, here are some steps you can do. The first step, unfortunately, is denture adhesive. And no one comes in saying they love denture adhesive, but sometimes you reach a point where there's not a lot of bone or tissue for the denture to grab onto, and adhesive can help kind of give you that bond and a little bit of stability so it's not moving around quite as much. A lower denture by nature is going to have a lot of imbalance. So it's really important, number one, that your upper teeth are balanced and you want a full complement of teeth. If you only have teeth here or there, that lower arch is going to wobble because it doesn't have the chewing partner on both sides of the mouth. When it comes to chewing with a lower denture, it's going to be very different than with your natural teeth. By nature, everyone has a side that they prefer to chew on. I myself, I'm a right side chewer. Not something I think about, I've just realized it over the years. But when you chew with a denture, you have to chew differently. It's going to be weird at first, but you have to learn how to chew balanced. You have to put food on both sides of the mouth, because even a perfect fitting denture, if you put a big chunk of food on this side, when you bite, it's going to want to lift up because the other side is being held in place. So you have to kind of train yourself and teach yourself to chew bilaterally, and by that I mean on both sides at the same time. You also have to train your cheeks and your tongue muscle not to push it out. And so I always tell patients, a lower denture, it's a learning curve. You have to really learn how to keep it in place, and the more you practice, the more you chew with it, the more you start with smaller foods, not starting with hard foods, not starting with sticky foods, easy foods. You're going to kind of train your muscles and your cheek to really hold that lower denture in place. The final solution, the gold standard if you will, is dental implants. What dental implants are basically titanium screws that go down on the bone, and then we're able to add attachments or anchors onto those. So the inside of the denture actually has snaps that when you put it in, it'll snap into place. And those retentive snaps allow the denture to stay in place and not move around and wobble. In an ideal world, we could put 4 implants in your lower jaw and attach that denture in there. You'll still have to take it out at night to clean it, but when you put it in, you've got the peace of mind and confidence that it snaps into place and stays in place. Here are some questions you need to ask your dentist if you find yourself in the situation where your lower denture is floating around, moving on you, not allowing you to chew properly. Number 1, is my bottom denture still fitting the ridge properly, or has my bone and tissue changed in a way that there's no longer a good seal? Number 2, if it fits properly but it's not getting the retention you want, which adhesive would you recommend, and can you show me how to apply it? Number 3, are dental implants an option for me, and would that increase my daily satisfaction with my denture? The main point is, I don't want your dentures to hold you back from enjoying your meals. Something that I always tell patients is a denture is not a replacement for your teeth. It really is a solution for having no teeth. And so if you approach it that way and know that the more you use it, the more you train yourself on it, the better it'll get, it makes it easier to adapt to life with a denture. If you find yourself struggling with your bottom dentures, please give us a call. I'd love to take a look and talk to you about your options for improving your lower denture. Feel free to like, comment, or share this video. Hopefully it was helpful. I'm Dr. Brett Langston. I'm here to help you watch your mouth.
Down in Brookhaven with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on parts, the dumbest you've ever seen.